Welcome to the College of Health information session. We're excited today to tell you about the newest college at Lehigh, the College of Health, and to also introduce you to some of the staff and students in the College of Health. Next slide. So Lehigh creates colleges to rise to the moment. The big example is that in 1865, Lehigh was founded during the Industrial Revolution with a real focus on manufacturing and science. And then in 2020, the College of Health opened in order to address the complexity of our health needs and the disparities around health, globally speaking. It's also a huge opportunity for students in the College of Health, just given the labor market in healthcare. So you can see that almost 1 million companies, nonprofit organizations, and then if you also add government organizations to those numbers, employ, focus on healthcare in our economy in the United States. And between 2019 and 2029, employment opportunities in the healthcare sector are expected to grow 15%. So this is a lot of opportunity for our students. How do we prepare them for that? Next slide, please. So if you are considering Lehigh and considering the College of Health, we think the College of Health is right for you if you want to help improve human health. That's a big topic, and there are lots of ways to approach it in this complex sector. You can be pre-med, pre-dental. You might be interested in eventually imagine yourself with a startup healthcare company. I can tell you that I've learned from some of our alums that digital startups are one of the biggest digital health startups are one of the biggest startup areas happening right now. If you're interested in health policy and healthcare reform, this is a great college with majors that might be interesting to you. And if you're someone who enjoys math, computer programming, and you're into health data analytics, you can imagine yourself doing that. This is also a great choice for you. Next slide. So the College of Health has sort of two big areas of focus that encompass really everything. The first is data science. So by understanding how to analyze data, our students are able to actually come up with interventions for some of the major problems that we're facing around health today. So we have faculty doing research around cancer, asthma, obesity, maternal and child health, and more. And one way they approach this is through large data sets, looking at, for example, how you might be able to predict when, let's say you have a data set from home health data, you can go in and see what were the predictors in this data that have to do with the individual's, health state, blood pressure, just the basics even, that would predict them being readmitted to the hospital, and therefore would allow us to prevent something like that, right? So data is powerful, and right now in the United States, there's a 50% growth in the labor market in data science across all sectors, and data science jobs across all sectors, and that includes the health sector. So our students who are interested in this aspect of health learn biostatistics. They learn how to program in both R and Python. And then they get into, if they want to, they can go into more advanced biostatistics and data analytics classes and get into machine learning and artificial intelligence. Next slide, please. The other big area that the College of Health is fully invested in, all our students get a great background in this, is understanding determinants of health. When we understand determinants of health, which are upstream causes of health and illness, then we can promote health equity. We have a cool little video here that explains what population health is and how determinants of health fit in with that.
The world is facing more complex public health challenges than ever. From persistent crises, like the obesity, opioid, and gun violence epidemics, to emerging crises like the COVID-19 pandemic. We can solve our public health challenges by focusing on the multiple factors that influence the health of large groups and communities. Population health is rooted in the science of understanding the multiple determinants of health. From cell to society. Population health is a convergent science. It brings together relevant academic disciplines like epidemiology, psychology, sociology, economics, political science, engineering, and biomedical sciences to drive the innovations and interventions needed to create better health outcomes in communities everywhere. Population health prioritizes and advances equity because it shines a spotlight on an overlooked scientific fact. Zip codes are better predictors of overall health than genetic codes. Population health is changing the world, one community at a time, and helping millions of people around the world achieve better health outcomes. To learn more about population health and how you can join the population health workforce of the future, visit health.lehigh.edu.
Great, next slide, please. So clearly the healthcare in general, globally speaking, is complex. There's lots of opportunity, and there are lots of ways to contribute. So how do students in the College of Health figure out what their role might be in the future? There are three aspects of the College of Health that contribute to a distinctive education. The first is an innovative curriculum, and I'll get into some details there for you. The second is experiential learning, which we strive to weave throughout the student's experience in the College of Health. And the third is an integrated career and professional development. So students encounter these steps in exploring careers and developing their own ideas about their own career all the way through their education. Next slide. So taking a look at our programs, we have two majors in the College of Health, the BS in Population Health and the BA in Community and Global Health. And we'll take a look at what those curricula look like in a second. We also have 5 minors. So minor programs are about 4 classes each, and these are available to folks within the college or students from across the university who may be completing majors in other colleges. So you could have a major in finance and have a minor in global health, for example. So we also have 4+1 degrees for our majors. And so 4+1 means 4 years of a BA or a BS, meaning the 2 that we offer. And then either the MS in Population Health, the Master's in Public Health, or the MS in Healthcare Systems Engineering. There's a real advantage to this structure. You kind of get 2 degrees. You get 2 degrees in 5 years. The advantages are that students who are majoring in population health or community and global health will be automatically accepted into the master's program of their choice if they have a 3.5 GPA at the beginning of their junior year. This allows them to complete what's usually a 2-year master's degree in half the time, and the graduate tuition for that master's degree in that 1 year is discounted by 20%. So there's a lot of advantages to that. Next slide. So let's take a look at the BS in Population Health. So the BS is a data science heavy degree with a really firm foundation in the determinants of health. So you can see that here, that there's some introductory classes, including epidemiology. Then there's a sequence where students learn biostatistics in that programming that I've talked about. They learn sort of introduction to programming in R as well as in Python, and that allows them to analyze data. So for example, they might in Professor McAndrews' class actually have access to data related to COVID-19. Dr. McAndrews' own analyses, he shares them with the CDC so that they can help predict what's next in this COVID epidemic, for example. So they're working with really interesting relevant data in these classes. You can see the determinants of health here. We had a little video about that. There are biological, environmental, socio-cultural, and political determinants of health. So for example, we have faculty who work with the American Indian population, Native American population. And there's a project that focuses on smoking cessation, and they understand the culture around tobacco, right? And when you understand that tobacco is a sacred thing in Native American culture, then you're going to take a different approach to actually working with folks to stop smoking. And so this is the kind of thing that students are learning in the class. There also is a capstone project for all students, which is really exciting. That's something that a student determines they want to really work on with an individual faculty member. This is also a highly customizable degree because there are concentrations. So students take 4 courses in a particular area of their choice. And we've listed some of the options here, which are sort of obvious because they're related to our current faculty's expertise or our minor programs or whatever. But students can also, choose to structure this in the way that they that matches their interests. Okay, next slide. The BA in Community and Global Health is a little bit more focused on the determinants of health. You can see that rather than 2 out of 3 classes on determinants of health, those 3 determinants of health classes enter into the core requirements of this major. This is a very applied major. So students who complete this major will have the ability to understand health issues from a community perspective, to work with individual communities to find out what are their highest priorities in terms of addressing health problems. And they'll understand how to design interventions, implement those interventions, and assess those interventions in communities, whether those communities are global or domestic. This course also has a methods requirement, including at least 1 quantitative course. So it could be one of those biostatistics courses. And they also do qualitative research here, which is more like understanding, verbally rather than through numbers, what's going on. Because they're working with communities, we want students to really have some kind of grounding in these communities, whatever they are. So let's say a student's interested in Latin America, then for their cross-cultural and diversity requirements, they might take 3 courses in our Latin American Studies department and study Spanish as their collateral requirement for a modern language. Like the BS, the BA is highly customizable. So once again, a student will choose four courses that focus in on some particular aspects so they gain some expertise in that area. They also will do a field experience or a practicum, and that can be something that you accomplish during study abroad, which is an exciting aspect of this program. Next slide, please. Starting in fall 2022, we're launching our graduate programs. We offer 2 certificates, one in population health, one in global population health. Each of those have 12 credits, and those 12 credits can be counted toward our MS in population health or our master's in public health. We also are launching in summer 2023 a joint program with the College of Business. It's a dual degree program where you earn both an MBA and an MPH in 18 months. And we are offering the healthcare management concentration for the Flex MBA in our College of Business. We also will be offering a doctorate in population health. Next slide, please. So what makes all this work? Faculty, really amazing faculty. So right now we're in a major hiring mode. We have 11 faculty. We've hired 2 additional faculty who will be starting this year, and at full strength will be about 55 faculty in the College of Health. These faculty are maternal and child health specialists, they are community health specialists, they're epidemiologists, they are cultural anthropologists, medical anthropologists, political scientists, and biostatisticians. And that's not all. I've not named even every field that we have in this small group. And we'll be continuing to grow out those areas. We also have faculty from across the university affiliated with the College of Health, more than 50 in the other colleges at Lehigh. And this means that they will be conducting research with our students and faculty. And they also may be teaching for us or with us. This means that students who enter the College of Health have access to a wide range of faculty across the university, which is really exciting. Next slide, please. So another feature that is something we've never done before, for the first time this year, we have a distinguished scholar in residence, Joan London. And I always say that the parents who are listening might know Joan London. If you're about my age, you might have watched her growing up on Good Morning America. She was one of the first women who was an anchor on a major news network. She is teaching at Lehigh a class called Population Health in the Media this semester. And what's so great is that even if students haven't heard of Joan London, they will be interested in a guest that she's able to bring into this class. So every week she brings in a different major figure in population health in the media. And that's a really exciting class. We've gotten some good feedback on it. And next semester, she'll be teaching for us again with a slightly different focus. Next slide, please. So we get to the experiential learning part of our three-part promise, if you will. So we've talked about the innovative curriculums, moving on to experiential learning. Even after being open for just over a year, we've had students do research with faculty. And the pictures you're seeing here are from a forum we had where students talked about their research that they did over the summers or their internship experiences, which we'll also talk about. But students did all kinds of research with faculty, and you can see here the list, ranging from taking an epidemiological approach to liver cancer, to looking at environmental pollution and asthma in Pennsylvania, to looking at community resilience and safe motherhood in Sierra Leone. So many opportunities here for students. Next slide, please. We also have a pretty amazing opportunity with our United Nations partnership. So Lehigh University was the 6th university in the world to have NGO status, meaning non-governmental organization status at the UN, which gives you certain rights and privileges and obligations in that global community. How that works on the ground for us is that students have opportunities to once a week, a bus goes to the UN every Friday, taking classes, or people who just want to go. And students have the opportunity to tour the UN, which is a great tour. I took a class myself. The class was the literature of contagion. And so we had a great time. We toured the UN, but we got to also meet with, and this was really amazing, an epidemiologist who was on the ground during the Ebola outbreak in Mali. And so he told us about what that was like to be on the ground in an outbreak kind of situation. So it's a great opportunity. Students can also serve as representatives for various NGOs who can't send their own representative because, let's say, they're in Nigeria and it's just too hard to get here, or if they're in a conflict area and they can't travel, or eventually, who knows, with COVID, when we're going to actually have all the international members be able to come to New York. But as you know, New York is not too far from Lehigh, New York City. It's about hour and 45 minutes to get there. And so it's a day trip, which is great. We also are working on a partnership with WHO. Lehigh University is, with the College of Health leading the way. That's very nascent, but there's another opportunity for students. Students also can do study abroad in very specific health-focused programs. So there are a number of programs that we are partnering with the organizations SIT and IES that are focused on health around the globe. There's probably like 15 that students have access to if they want to have their study abroad be related to health. And then we have programs that are created at Lehigh for Lehigh students that are focused on health. And just a couple of them I can name are there's one at the University of Galway in Ireland, which focuses on sort of social science approaches to health. And then there's one in the Dominican Republic during the January term, which sounds like a great place to go for January to me. And that was focused on health equity. So right up our alley in the College of Health. Next slide, please. A piece of this, the structure in the College of Health that really promotes research and invites students into faculty research are these 2 research centers that we have. So the first one I'll talk about is the Institute for Indigenous Studies. This is an institute that focuses on Indigenous peoples both in North America, particularly the United States, but throughout the Western Hemisphere. And they have a number of research programs going. This is a very well-funded institute. I mentioned one which focuses on smoking cessation, but they also work on healthy home environments, mental health issues, and maternal and child health. And I think last summer, the Institute for Indigenous Studies had 12 students working as researchers with them. Next slide, please. We have a brand new second institute, the Institute for Health Policy and Politics, which was just approved, and it's getting on its feet. But the core of this institute are our 2 really world-renowned health policy experts, which is wonderful, and we'll grow out that area as well. They've reached out to faculty across the colleges who also work in political science and health policy to join this institute. And once again, students here will get experiences like preparing, looking at those data that you're learning about in classroom to understand health problems, and then considering how do you move from that to a policy recommendation. So the kind of experience the students can have in the Institute for Health Policy and Politics can lead them to either serve in government or potentially work for a think tank. Next slide, please. We're really excited that all this will be happening in the new Health Science and Technology building, which will open in January 2022. This is a really unusual building on Lehigh's campus. It's our largest building that we've ever built. It faces the community, which I love. It's the only building at Lehigh to actually face the community of Bethlehem. And that's important to us because of our focus on community health. So we have a community health room. It's a lovely two-story, gathering place for the community to talk about community health issues. And when I say community, I mean the Bethlehem community, the Lehigh Valley community, and of course the Lehigh community. Other resources that are relevant for our researchers in the College of Health include the Health Data Warehouse, where students and faculty will be able to work with multiple kinds of data sets and work on data visualization after they do that analysis in the data visualization lab piece of this. We also have a biospecimen repository, which enables faculty to do research at more of a molecular level. So molecular epidemiology, for example. We have a faculty member who's working on finding a second species of asthma. And if she is able to do that, that's really quite exciting because that means that we may have a different way to treat asthma than with just corticosteroids, which is that's the hammer that hits every nail that looks like asthma. And if she can determine that there's a different causal mechanism or different genetic or environmental mechanism at play, there may be a different way to solve that problem. Another thing just to say about the building is that it's different in another way, that it really encourages collaboration across disciplines among faculty and among students. The labs are shared spaces. They're open, meaning they're glassed in, so you can see everything going on in the labs at all times. Faculty offices are in the interior of the building rather than on the windows. And that's so that on the windows, we can have common workspaces, whether that's a computational area for folks working with data or a conference room for people who are working through ideas together. There are also some wonderful places for students to hang out. There's a cafe, and the College of Health is, students get to lead the naming of that cafe, which will be really fun. And there are wonderful study areas which have these crazy views. Just everything is glass and metal and wood. So it's a really beautiful building. Next slide, please. So if you were to come to Lehigh and the College of Health, what would you do with your degree in the College of Health? There's so many answers to this question because, as I mentioned a couple of times, healthcare is really complex. And so this is why we want students to be exploring this question throughout their careers. So, you might sort of have never really known what epidemiology is, but then you take an epidemiology class and you think, you know what, I really like this approach. It fits with my thinking. There's so many ways that I can impact people's lives by becoming an expert in this field. And so that's one option. Or you may decide you want to do a double major in economics. So we have someone who's doing that. We have a couple of people who are doing that because you really are interested more in this sort of the business side of health, which is a huge part of our economy. And those folks are very much needed too. Or you may want to work on a global scale. And of course, we've listed here the Sustainable Development Goal 3 is to ensure healthy lives and promote a well-being for all at all ages. That is a big goal, and it's a globally shared goal. Next slide. Just to get into a little bit more detail, you might look at careers across multiple sectors. So again, you can see why we're integrating the exploration of careers into our curriculum, because there's so much to think about and so many to choose from. So someone might be a physician who has, went to med school after getting a population health degree or a community and global health degree. And I should take a minute to say that we are very welcoming of pre-med students and have worked out how you can accommodate the pre-med classes and complete those along with our major. We have a faculty member who came to us from a medical school, and she has taught all of us that actually majors in fields like population health and community and global health that are related to health, but maybe aren't the bio major that a great percentage of applicants to med school have, are really stand out, and they really give you an advantage. As long as you have those pre-med requirements completed and you do well on the MCAT, then this is a really big plus for you. And it helps us prepare physicians and other folks working in healthcare to be aware of upstream causes of health and to be very comfortable with data. So those are some options. We have great relationships with consulting companies at Lehigh, and now we're able to actually prepare our students to take on their jobs with like Deloitte and McKinsey in the healthcare sector. So they usually call it life sciences in these practices, and they're really big practices where you can serve as a consultant. And they train people, once you get hired, they train you to do that. So we have can envision careers for students in nonprofit organizations like the World Health Organization or World Bank, in philanthropies. So you might not think about as a career goal at this moment when you're entering college, being a grant officer for the Gates Foundation, but how cool would that be that you have enough background in population health and community and global health to look at proposals to the Gates Foundation around global health and make decisions about what looks really promising, right? How can you work with people to make these things a reality? And there are lots of opportunities in government and US federal agencies as well, including, of course, the CDC and local and state health bureaus. And even something like the Congressional Budget Office needs experts who actually understand the financial financial side of healthcare. We're actually offering a course next term on exactly that, healthcare finances. So next slide, please. So I've mentioned this integrated career and professional development a couple of times, and I want to point out some of the internships that our students had last summer. So these are both paid and unpaid internships. We try to offer some funding when students get really relevant unpaid internships so that those internships are accessible to everyone. One example of that is the PA Department of Health offered a health equity internship this summer that was unpaid, and so the college was able to provide a stipend for that. So you can see here that students have worked with government organizations, with private companies, like LifeScan Inc., with a variety of sort of health network hospital settings, and in research institutes. And this is just these are real things that students did after just 1 year. That's really exciting. Next slide, please. So I love students. That's why I'm in the business of education, and we want students to help us build this college. So we have Dakota here. Dakota is one of our core students who always is willing to come to stuff and to participate and to give her opinion about how the college is going and how we're growing. And so there are a couple of ways which students can get involved in that. One is through the Student Advisory Council. We had a great meeting the other week where, it's really clear these students want to get in and get working on stuff. So that's wonderful. Then we have a group of student ambassadors who help us with admissions and recruitment. So if you're interested in talking to a student, let us know, email the College of Health and let us know. We'll hook you up with a student who will talk to you about what it's like to be in the College of Health. And then once a month, we have a student roundtable where I and usually a special guest meet with students just to hear what's going on or to let them know about some opportunities on campus that are exciting. So we have a couple of comments from students in the next few slides. So you can see that students are really loving our faculty. When we first asked students, how's it going? What are you experiencing? The thing that came up the most often was that the professors were very helpful. They were really encouraging of research and inviting students into research. And we're a startup, right? So we're a small college right now with it. And so there's a lot of hands-on attention from faculty, which is wonderful. Next slide. So this is a picture of one of our first graduates from the College of Health. He was a minor in global population health. He's a population health, sorry, that was global. So population health minor, and he is going to dental school. And so he thought that this minor would be really great to add to his pre-dental classes. I mean, it's true that dental health is a major public health issue, actually, and it's an access issue, right? And so he gives you a sense of what his minor meant to him. So I want to turn now to your questions for those of you tuning in, and I'm excited to introduce my colleagues, Rick Birchfield, who is the Director of Marketing and Communications for the College of Health, and he'll be managing the question and answer session, and Sherry Buss, who is our Director of Administration in the College of Health, and also a parent, as you see in her title there, of one graduate and one current student who's actually in the College of Health. So, and then finally we have Dakota Feldman, who I've mentioned before, who is a population health major, and we're really happy to have her here. And Rick, maybe you want to start with Dakota.
Absolutely. Thank you, Dean Dolan, for the introduction. Some great stuff there. And Dakota, I think it would be nice to let everybody know kind of how did you find the College of Health and what made you decide, seal the deal that this is where you wanted to be, this is where you were going to apply and then ultimately come, especially knowing that, it was a brand new college at that time.
I think for me, what definitely stood out is initially the way that the college was explained to me during the info session I went to here. I had never really heard of public health or population health prior to it. And I always had an interest in biology and medicine, but knew that med school was just definitely not the route for me. And I didn't want to be pre-med. So I heard them describe it and say, well, it's not nursing and it's not pre-med, but you're working hands-on with, the community and you get to advocate for people and help. And kind of hearing this mishmash of different areas come together, I realized, this is exactly what I want to do without even knowing it. And I instantly looked into, what public health is, what population health is. And I applied to Lehigh solely for this college. Arts and sciences would have been great, but the College of Health I knew was exactly what I wanted to study. And it was one of the few schools that really had a program that I was really passionate about. And I've loved every single second that I've been involved in it.
And that's great. And I don't know if you want to expand a little bit on that part of it, because obviously it's great to see everything from the outside. And this sounds great. I'm going to go there. But what's it been like to be on campus and to be with this first real group of students in the College of Health?
Yeah. So I think what's really nice is all the professors are extremely helpful and accommodating and really want the best for you, and they want you to be able to succeed. And they put that as their top priority. So if you ever, are struggling with something in a class, I'm not the best at math and we have to take biostats for for one of our classes, but the professors are so helpful that doesn't become an issue. And so even though it sounds scary at first, they make it so that it's actually really achievable and that you do well. And I think that's one thing that everyone else I know in the College of Health will say, on top of it, is that the professors are what really make this college so special, because they all come from such different backgrounds and they're so passionate about their research and what they do that it really makes it so interesting to learn. And they really just keep you so engaged in the material.
Thank you for that. Speaking of different viewpoints from the student's standpoint, but then also the parent standpoint, Sherry, as Dean Dolan pointed out, knowing that you had two students here, two sons, one who graduated and one who's actually in the College of Health right now. What has that been like for you from the parent standpoint? How has that experience been for you and from the outside for him as well?
Well, as a parent, your responsibilities are always to try to guide your students to the route that's going to make them happy in life. And I would say with my older son, he entered Lehigh in the College of Arts and Sciences. He pursued a major in journalism. That wasn't enough for him, so he added a BS in accounting. He did two minor programs, one in international relations, one in Africana studies. He had the opportunity to participate in experiential learning in Africa and Uganda for a summer, where he worked on a health-related program, which was fully funded by the university. So Lehigh provided him so many opportunities. And ironically, when he graduated, He ended up getting a job through a healthcare system, and he's now pursuing an MBA where he's focusing on the data analytics. So I always say, boy, if the College of Health had been here when he was at Lehigh, he would have been such a good candidate for some of the programs. But fast forward to the second child, who didn't really know what he wanted to do at all. So he went to community college for 2 years, and just this past semester transitioned to Lehigh into the College of Health. And he's finding his way through the community and global health major. And he is enjoying it so much because he's not a test taking type of person. He's really a project based. And with the faculty being so engaged in the classroom setting and involving the students in research opportunities, the hands-on type of learning that he's experiencing is just, it's really good for him. And he's a commuting student as well. So while you would think that that might be more of a challenge to connect with students at Lehigh, it has not been for him because of the way that our classes are run. So overall, he's had a really great experience. And as a parent, to see your child find their way and find their happiness is just so fulfilling.
That's great. And experiential learning obviously is a big topic for a lot of parents. And you know, Dean Dolan, when people hear that, sometimes they think, okay, that's typically a graduate program thing, or maybe students in their third and fourth year in undergraduate program. But can you give those attending the session a sense of how the College of Health looks at experiential learning?
Yeah, we want students to be thinking about real world problems all the way through their careers. And so those might end up being case studies in classes. Like I mentioned, the data sets related to COVID-19 that students, get to work with and biostats. Or it might be actually working in communities as a piece of the class, right? So that's one way. Another way, of course, is doing research with faculty, which we've talked about. Also seeking out these internship opportunities. We have an alumni group called the Healthcare Alliance, and those guys have offered to be mentors to our students and to serve as their alums, because of course we don't have alumni yet. Well, besides Nick, who I mentioned, who was a minor, right? But we don't have a big body of alumni who graduate from the College of Health, yet. And so these folks are available for students to connect with through Lehigh Connects, which is run through our Center for Career and Professional Development, to talk about real world experiences. So it's really just runs throughout everything that we do in the college.
Right. And pretty soon, a lot of that research is going to be done in this new building that you talked about and, detailed. But Dakota, if I'm not mistaken, you were able to take a tour or two of the building as it's been built. If that's the case, can you talk about what that's been like and anything that stood out to you?
Yeah, I mean, I think obviously the building itself is, gorgeous, and the research, rooms in there are going to be amazing to actually be able to use and be inside the building. But I think the biggest thing that, everyone kind of took away from the tour, and that I noticed everyone kept saying who was on it, who were also other College of Health students, whether they were freshmen or sophomores, I think, and some juniors, was that everyone just wanted a place that we could get to call home. And so, everyone, all these other colleges, they kind of have one main building or two main buildings, and, we're all anticipating, our building to be finished. And so I think that was the coolest thing, was everyone, kept saying, all right, but this is going to be our home. This is where we're going to come to do work. This is where we'll have a class take place. Oh, I get to do research here. And it was kind of those small things and those small moments, honestly, to me, that stood out more than even touring the building, was everyone's excitement for this building to open, and really having a place that, okay, we're officially here, we're this college, but now we're really here. We have our building. You can see it when you come down the hill, like, we're here. And I think that was the best part of it, definitely.
That's great. And a lot of that work with professors that you're talking about, and Dean Dolan's talking about, it kind of harkens back to a little bit of what you were saying about how, impressed you've been with the professors. So, is there any particular class so far in the College of Health that you see as your favorite? And if there is, does it stand out because of something that professor did? And would you, tell us a little bit about that?
Yeah, so I definitely say I have two standouts. I'd say one this semester is my Population Health in the Media course with Joe London, which was kind of mentioned before. And she's amazing. To just hear what she's done and who she's gotten to meet and interview, you know, her life story is absolutely unbelievable. But then on top of that, the speakers she brings in are so fascinating to hear from. And personally, I didn't have a big interest in the media before. You know, I was like, okay, this class, she's a great speaker. I've heard she's very interesting. Like, I'd love to, you know, learn from her. And then now it's kind of taken another route of, oh, wait, this is something I'm actually kind of interested in, of this like media journalism side of population health, because I think I thought of it more as just science, but now I'm realizing you can kind of bring the two together. So I think the way that she runs the course and what we do is we have one day of where she just interviews someone. And so you get to watch her, you know, really do a live interview in front of you, whether it's, you know, they're on Zoom or some have come into class themselves. And then the next day we have a class where we just discuss it. And we discuss, okay, what did they really say? And how does this relate back to our other courses that we're taking? So it's kind of applying the real world to exactly what we're learning. And then I'd say another course that I found really interesting in a kind of totally different way. I took it last semester. It's called Biological Basis of Population Health. And for me, we talked a lot about different diseases and, you know, how they spread. And that was more focused on the biology side. And that was part of the reason I even really wanted to go into population health in the first place was I love medicine, but pre-med is not me and I don't want to be a doctor. So it kind of showed me that, oh, okay, I can actually still do this and still have my interest, but, you know, not do pre-med, and it's okay. And this really will, you know, maybe work out in the end. So I think that was a cool realization for me to learn exactly what I'm interested in, but doing something that I really, really like. And yeah.
Very, very cool. I think we have a time for maybe a couple more quick questions. What I'm thinking is maybe, you know, at the end, Dean Dolan, you can maybe kind of wrap it up and leave everyone with some things that you think that they should you know, keep in mind. But I'm wondering, Dakota, a lot of the people on here are students probably really starting to think about where it is that they're going to be going. And do you have any advice, you know, as someone who went through the process of trying to find the right institution and the right college, on, you know, what you think is important to keep in mind as they're going through that process?
I think one thing in particular is you really do want to find a program and an academic setting that you're passionate about, because at the end of the day, you are there to learn and for the academics, and it makes doing the work that much easier if you really love what you're doing. So I found that, you know, we still have work, we're still working hard all the time. And the fact that I'm really interested in the material and I want to know more makes it less of a hassle and makes it more something, you know, okay, I can do this, instead of, oh no, I have to do this. So I've definitely seen that be a, you know, major plus. And I think also find somewhere that you walk around the campus and you really see yourself reflected, because that was something I felt when I was at Lehigh. I did have the aha moment that they all talk about in the college admissions office, of, oh wait, I really love it here. And so I was really lucky to find that. But even if that doesn't happen, you just want to walk around. And for me, I saw everyone in Lehigh apparel, and you could see the spirit without even really going here and knowing much about the school. So that was a really small thing to me that even stood out. And then, you know, this program on top of it, and just a bunch of other things that I knew I was looking for in a college kind of all lined up together. And this was happened to check all the boxes. So I think just really keeping an open mind, but remembering that you want to find somewhere where they have what you're passionate about.
Great. And Sherry, for any of the parents that are on here, obviously you've gone through that process from that standpoint. Anything that you think they should keep in mind while they're, you know, they and their students are looking at the next place for them to be?
That there's a light at the end of the tunnel. I know it's a long, grueling process, but I think to Dakota's point, every student just seems to say that they've had that aha moment, and they just know that it's their place when they find it. But what I will say is that Lehigh is just so welcoming. I mean, I've worked here for over 20 years. And the interactions that I've had with students and families has always been so positive, and people have always felt like Lehigh is home. And that's the culture that we create in the College of Health too. That comes from the dean, it comes from the staff, it comes from all the faculty, that when the students are here, they're home, and that's how we treat them.
Great. Thank you for that. I think we're running up on time, but Dean Dolan, are there any thoughts that you'd like to leave with those who have attended today?
Sure. Yeah, I guess I would say, first of all, thank you for joining us to learn more about the College of Health. And you can see how amazing and dedicated our staff are. We've been bragging about our faculty throughout the whole presentation. And I want to end really focusing on how amazing our students are. So if that's clear, I think from Dakota's, answers to questions. But if you are looking for a place to join where students are kind of up for a challenge, right? Like global health is a big challenge. There's a lot to work on. And the students who started, so Dakota's in the very first class in the College of Health, which is really neat. And so, the students in the first class and in the second class, and then in the class that you might be considering entering, are really involved in a startup. And so in a startup environment, it's an all hands on deck environment, right? So students help with things, staff, faculty, all get in there and work to fulfill this vision, this shared vision for the College of Health. So it's a really exciting and very unusual, I think, college experience to have that opportunity. Our students are passionate, they are extremely hardworking. They care about the world and they want to make a difference. And we really hope that if that's you, you'll join us too. Thanks so much.